My name's Mark Harris, and I've worked as a trained midwife since 1991. In fact, I trained in 1991 uh, to work as a midwife. Now, when I started working within kind of the birth world, there were about 38,000 midwives, and I think at the time 21 of them were men. So it was not it was unusual to have a male midwife back then. Now, over all of those years of working with women and their partners in the context of pregnancy and birth, there has always been a significant number of women who, when they look back on their experience of giving birth, they would say they have suffered. And of course, I'm not talking primarily about physical suffering. Of course, some women have complications due to cesarean birth, due to second, third, even fourth degree perineal trauma. That happens, but there's always been women who would say that as a result of their birth experience, their emotional life, their relationships with others have been impacted to the point where they would say they are afraid of giving birth again, or they would say, I never go near the hospital where I gave birth, or they would say that I'm kept awake at night thinking about birth experiences. Now, we're talking 25, 27 years, maybe almost 30 years. There's always been a significant number. Now, about 4 years ago, the Birth Trauma Association suggested that as many as 200,000 women a year consider their births to have been traumatic. 200,000 women a year. Now, those statistics are about 4 or 5 years old. So, having been through the apocalypse, the COVID experience where, women were separated from loved ones, where the number of people within the birth room were reduced, I can only hazard a guess that the numbers are more than that. Now, I'm going to just spend a few videos talking to you about birth trauma and about what potentially can be done to support those people who are suffering. So I run a training called the Birthing Awareness 3-step process. It's a non-therapeutic process that someone who isn't a therapist can lead another person through, which seems to alleviate or lift feelings that are labeled traumatic in the context of a birth experience. So the video today is just to say there is a big issue within the birth world. Women and their partners are suffering. But there is a solution. There is a process that is non-invasive, that can be learned over 2 days with pre-learning, that can support those who are currently suffering.